Hey guys, it's Dr. Beauty MP here. How are you guys doing? Like, it has been at least, I think, about 2 or 3 weeks since I've last done this. So it's been a while, so I feel like I'm a little rusty, so I have to get used to all of this again. But how is everyone doing? As you can see, we are streaming on Instagram now. Yes, we are moving up in the world, right? At the time, we can only stream on Facebook, YouTube, and directly through our link. But we are officially on Instagram now. So thank you all for joining. It looks like we have a few new faces in here. So welcome, welcome. Welcome to Health Tea with Dr. B, the MP. Hope everyone is doing so well tonight. We are on episode 11. Okay. Happy holidays because we are literally a week and some change away from the new year. 2024 has crept up on us just really fast. I just remember it being January 1st, and now we're about to see another January 1st. So I hope you guys are doing well. Again, I miss you all. So let me tell you all about what I've been into. Okay. So I have been on my own journey as well as being really busy with our practice, True Phoenix Community Care. Um, been really busy, and that is a good thing, right? It's a good thing. So on December 1st, I decided that enough is enough. How can you take care of others if you are not taking care of yourself, right? So I just decided to put my best foot forward and stop being so anxious all the time. Around this time of the year, I get really anxious, I get depressed, and sometimes I think it's because I'm reflecting on what happened from January to November. Did I complete all my goals? Did I lose weight? Did I do this? So I just decided to push all that to the side, and I decided to really get in with my good friends, and we all are doing a challenge together. And it's a lifestyle change challenge. And so far, I am 12 pounds down. I'm drinking 3 liters of water per day. I'm doing well. My skin is getting brighter. As you all know, I do suffer with PCOS, so my symptoms are starting to reverse. The acne that I have from the PCOS and insulin resistance, that is starting to improve. So I am doing well. So that is just a small update. Hello again to a lot of my new faces. This is Health Tea with Dr. B, the NP here. This podcast is to empower everybody, whether it's other practitioners, doctors, providers, or my patients, or other patients, or those who are just simply looking for a way and trying to figure out what's what's real, who to listen to. At the end of the day, you want to listen to your body, and then you want to go to a provider who is going to give you the best education possible. So, again, here, I do not take the place of your provider. All I'm doing is simply educating and making sure that you are able to advocate for yourselves. Okay. So, when you go to your doctor, you won't say Dr. B, the NP said it. You're going to say that you researched it, you listen to some great resources, and you are good to go. All right. And remember, if you are in Maryland, Washington, D.C., Colorado, New Mexico, Washington State, and Utah, and you are seeking treatment, the link is in my bio. Or you can go to bit.ly/health tea with Dr. B. If you know you need that consultation, just hit that button. Okay. And if you live in other states, I can always advocate for you and connect you with other providers who have the same mindset as myself. And also, if you would like to be a guest on the show to share your experiences or ask questions, please send me a message directly on Instagram or Facebook, or again, send me a message at bit.ly/health tea with Dr. B. All right. So now let's move on to episode 11, Holiday Blues Unwrapped. Now, this was actually the most requested episode for this evening. I had someone say, please talk about the holidays and how I'm feeling. So, if you can ask any of my other colleagues, I really do think about the titles of our podcast because I want them to relate with you. I want you to resonate with all of the material that I'm sharing with you guys tonight. But as usual, I have some hot tea for y'all. Okay, so now you guys know that I introduce a tea every week, and that is usually connected to our topic of the week, and they are usually loaded with benefits. So, this week's tea, and you guys heard it before, the tea for the week is lavender. Okay, and lavender for a very special reason for tonight's information. So, lavender tea, or lavender, is known for its distinctive fragrance and beautiful purple flowers, and it has various benefits, especially when consumed as lavender tea. So when we hear about lavender, I always think about aromatherapy, candles, oils, lotions, right? But what about actual consumption? Okay, this tea can be particularly beneficial for individuals dealing with seasonal affective disorder, also known as SAD or SAD. So here are some key points about lavender and the benefits of lavender tea in relation to SAD. So, number one, its calming effect. Lavender is renowned for its natural calming properties, and drinking lavender tea can actually help to alleviate anxiety and stress. Okay. Hey, I'm one of those people. I have anxiety at the most inopportune times, and lavender and rosemary usually does a trick for me. It also helps to improve sleep quality. So, lavender has been shown to improve sleep quality. So, those who have seasonal affective disorders, disruptive sleep patterns are a common issue, and this tea will actually help to regulate your sleep. And the soothing aroma of the lavender can also have a mood lifting effect. So, when you drink the tea, it actually might help to elevate your mood some, which is beneficial for those who are experiencing depression. So, again, it reduces anxiety, has a lot of antioxidant properties, and as a natural remedy, lavender tea provides an alternative or a complement to traditional treatments of SAD. So you heard that right? It can be particularly appealing to those seeking holistic or non pharmaceutical approaches to manage their condition. However, it can be used in conjunction with whatever therapy that you are currently on. Okay? And the ease of the use. Lavender tea can be easily incorporated into our daily routines. So it makes it a simple and a real accessible way to potentially alleviate some symptoms of SAD. So while lavender tea can be a beneficial supplement in managing symptoms of SAD or SAD, let's say SAD, okay? It's important to remember that it should not replace any professional medical advice or treatment. Okay, so what I'm not saying is stop your medical treatments. All I'm saying is that it can be used in conjunction with other treatments as part of a comprehensive approach to managing SAD. All right, and so you guys know that I debut a cup all the time. It's always a new cup, and this is a pretty good cup. Now, as you can see today, I just have a tea bag. Usually I actually have the leaves, but this is just fine. So I did let it steep for about 20 minutes. Okay, so let's see how it tastes. So not bad. Honestly, it literally just tastes how it smells. So if you're very if you're a person with a huge imagination like myself, sometimes that can be unappealing because sometimes you don't want to eat what you think you smell. So I know every night in my room I do burn lavender candle. So now mentally I'm like, am I actually drinking like lavender oil or so? But again, it actually tastes pretty good, and it tastes much better warm. I had it cold before, um, and this is the one with the leaves. This one here is the tea bag, so much better warm. Okay, all right. So now on to episode 11, Holiday Blues Unwrapped. So, are you feeling the winter blues? It is freezing outside. Do you even know what winter blues are? The holidays are creeping up on us, and are the blues hitting you harder? So join us on Health Tea with Dr. B, the NP, and stay for a while, where we'll unwrap the holiday blues. Okay? So let's sip, listen, and thrive. Okay? Did you know that the joyous holiday season can also bring a unique type of stress and sadness for many? This phenomenon is often referred to as the holiday blues. It's characterized by feelings of loneliness, anxiety, depression during this festive period. So, factors like the pressure to socialize, the financial strain, we all know about that one, and the remembrance of lost loved ones can intensify these feelings. So remember, there are some people who are experiencing their first festive holiday without their loved one. Okay, so tonight for episode 11, we're going to explore why the holidays might not be the happiest time for everyone and discuss ways on how to navigate these emotions. So tune in as we shed light on this often overlooked aspect of the holiday season and share tips on how to find joy and peace amidst the chaos. Okay. All right. So, what exactly is seasonal affective disorder? It is a type of depression that aligns with specific seasons, primarily affecting individuals during the fall and the winter. So, here are symptoms to watch out for. Watch out for yourself and others around because the common thing that I always hear about is, wow, I didn't know they were depressed. I just didn't know. How can I see? How can I see for myself if someone is depressed? How can I know if I'm depressed or experiencing sad, right? Or seasonal affective disorder. So, for instance, persistent low mood that starts in the fall and ends in the spring or summer, lack of energy and difficulty in concentrating, changes in sleep patterns and appetite, so sleeping much longer throughout the day and night, and withdrawal from social activities, more noticeable as the days get shorter. So these are symptoms that are specific to winter months. When it's the summer months, which are like more rare, you may notice someone who's more irritable and under eating and also experiencing insomnia. So it's a flip from winter and summer, excuse me. All right. So what I just described today was winter symptoms. All right. So though less common, SAD can also occur during the spring and summer months. Okay. So a unique aspect of SAD is its predictability, with symptoms recurring at the same time each year. Unlike other depression forms like major depressive disorder or persistent depressive disorder. So there are patients that I have who literally get sad every October 1st, and their symptoms break literally maybe April 15th. Okay. So this is a thing. So if you notice that, my mood just changes, people think that, oh, it's because it's dark outside. Yes, that is one of the things in the winter months. But what happened? Was there a past tragedy? So there's a lot of things that we have to dig into. Okay. So again, what are some possible causes of seasonal affective disorder? So we have the decrease in natural sunlight during the winter, which may disrupt our circadian rhythms. So here is some hot tea for you. Daylight saving time. Every time that time changes and it gets darker, let's say around 4 p.m., it's getting dark, that is where depression or SAD can hit. That is where. Lower serotonin levels, which is a neurotransmitter associated with mood regulation, and increased melatonin levels, which can also affect our sleep patterns and our mood. Okay. And how can this impact life? So, these changes with your mood can lead to significant alterations in sleep and mood, causing the typical symptoms of winter onset SAD. So, now let's discuss my functional medicine approach to seasonal affective disorder. So, why do I emphasize on functional medicine approach? It is because I treat things differently from a different lens. Okay, so we have mainstream medicine and then we have functional medicine. Mainstream medicine, yes, we're going to diagnose if you're depressed, but we're also just going to medicate and we may prescribe therapy, right? With the functional medicine approach, I'm going to try to find the root cause of why you're depressed in the first place because medications are not our first choice. It's not the first route because there are usually other things. Okay, so let's differentiate seasonal affective disorder from other depressions. So the first step is to distinguish them, all right? We have to recognize the seasonal aspect of SAD, which helps in understanding its unique causes, okay? Treatment and testing are specifically targeted to address the primary causes of SAD. So when we're thinking about winter onset SAD, this includes addressing the lack of sunlight. Okay. So when you guys go to, let's say, the doctor and they say, oh, you have depression, is the next follow up, hey, it's because of the lack of sunlight? Have you guys ever heard of that? I'm sure you haven't because that's not a topic of conversation. You might hear vitamin D levels, and that's minimal because sometimes nutrients are disregarded. Okay. So, lack of sunlight, that is specific to winter onset seasonal affective disorder. So, what are some holistic treatment protocols? Optimizing your vitamin D levels, optimizing your melatonin and your serotonin levels, and also prescribing light therapy during the winter months. Yes, light therapy. Okay. And how is this different from other depression treatments? So, treatment for SAD is different from that of major depressive disorder, also known as MDD, which might focus more on thyroid hormones and dopamine levels. So when we see SSRIs and things of that nature, we're looking at serotonin, dopamine, you know, and thyroid issues, they're also fine, but it's usually something that's causing the MDD. Whereas for the seasonal affective disorder, we have other things, again, like the sunlight, that could be causing us to be more depressed. So, what is the functional medicine philosophy? Well, I aim to identify and treat the underlying causes of symptoms rather than just the symptoms themselves, because I always try to move away from a one size fits all approach and go towards personalized medicine. Okay, so here's health tea for tonight. Get yourself a personalized plan for SAD, not a general one. If you find a provider who groups you all into a category, then that is not the plan you want because each person's SAD is affected by a different cause. Okay, so now let's dive into the functional medicine lab testing for seasonal affective disorder. Okay, so the DSM-5 diagnostic for criteria for SAD. So depression must begin and end in a specific season with remission at other times. So it's very clear. Whereas major depressive disorder, it can last all year round with no break. Okay? So, seasonal affective disorder, it is going to begin and end in a specific season. And there must be at least 2 depressive episodes within the past 2 years. And seasonal episodes significantly outnumber non-seasonal episodes. Okay? So again, seasonal affective disorder, it is very specific to a season, whether it's spring, summer, fall, or winter. Okay. And now, what about the role of lab testing? Because we always hear about thyroid and vitamin D. What can we do? While labs cannot directly diagnose SAD, they're crucial in identifying the contributing factors. So they help in developing a comprehensive treatment plan. So when you come to see me, I might say, yes, you have SAD, but that's not all. I'm not just going to recommend a medication or even therapy. I might say, how's your diet? Are you taking supplements? Okay. So here are the key lab tests for SAD. A neurotransmitter levels test. I'm sure most of you haven't heard of that. So, Why is this test important? Serotonin, known as the feel-good chemical, which is measured through the urine. So, tests that assess serotonin and its related compounds indicating mood and sleep patterns. So, we need to know, how's your mood? What's affected? How are you sleeping? Okay. Just like we need to test your vitamin D, which is important for mood regulation, and it's produced by skin exposure to the sunlight. So, those who have more melanin in their skin, we notice that there is more of a vitamin D deficiency, okay, because vitamin D is absorbed through the skin. So, vitamin D deficiency is common in the winter and it is linked to depression. And so, this must be assessed through the serum 25 hydroxy vitamin D levels. So, when we hear about vitamin D is known as the depression vitamin, right? So, it makes sense. So, it's low in the winter. Hey, we're talking about winter blues. Is linked to depression. Hey, we're talking about seasonal affective disorder, right? So everything there's a link to everything. That is what functional medicine is all about. It's all about linking things together, okay? And now melatonin levels. So melatonin, the sleep hormone, increases in the winter, affecting sleep and energy. So that means you're going to be asleep for a really long time. You're not going to have any energy. Have you noticed that? You're just more sluggish in the winter? So its production and circadian rhythm are often disrupted in SAD. So there are tests that provide a snapshot of the sleep wake cycle. So it'll be important to assess that to see how your sleep wake cycle is going. Are you sleeping too much? Are you even getting restful sleep? So think about sleeping for 10 hours at a time and still waking up tired, right? And now analyzing hormonal interplay. This is my favorite. So melatonin and cortisol, which is a stress hormone, these are levels that are often measured together. So, this helps us to understand the relationship between sleep disturbances, circadian rhythm, and stress response in SAD patients. So, here's a health tip for my patients. This is where the Dutch test comes in. So, the Dutch test is for females specifically, and I've just taken this test last month. And I took it so I can evaluate and do a deeper dive into my hormones. And what was discovered was that my cortisol levels were completely off. So my cortisol levels dip during the day, which is why I'm always tired when I wake up. But when the nighttime comes, like around 10 o'clock, 11 o'clock, my body wakes up. So my cortisol levels are through the roof. I would have never known that. I just thought that I worked better at night. Right? But no, there is an obvious flip. So I have to change something with my sleep wake cycle. I have to change it. I have to. There's no way that I can live comfortably like this with me always being tired, even though I work during the day, and then be wide awake when I should be asleep. Okay. So again, this is where the Dutch test comes in. So I do the Dutch complete for my ladies going through PCOS. And then I do the Dutch plus for those going through perimenopause or menopause. All right. So someone commented on my post earlier and asked if nutrition could affect SAD. It absolutely can. All right. So here are some diet preferences as it relates to SAD. So you guys know that I try to back up all of my things here. So a 2020 review found unique dietary patterns in SAD patients, such as vegetarianism, alcohol dependence, emotional eating, and overeating. Did you guys hear that? Vegetarianism, alcohol dependence, emotional eating, and overeating. So you guys already know where I'm going at with this. I'm talking about my vegetarians, you know. When we do or have a vegan or vegetarian diet, we always equate that to being extremely healthy, right? Extremely healthy. and that nothing can go wrong. But when you start to convert over to vegetarianism or being a vegan, you really have to make sure that your nutrients are in check. Okay. So the relationship between these habits and SAD isn't clear, but it highlights the needs to consider important dietary choices. All right. So here's the impact of diet on depressive disorders. So we have a diet that's high in ultra processed foods and added sugars. It can increase depression risk. Anti-inflammatory diets, such as the Mediterranean diet or the paleo, those can significantly reduce depression risk. Okay. And here are some dietary recommendations for SAD. So, again, an anti inflammatory diet is advised to prevent and treat SAD, and this includes fruits, vegetables, lean proteins, and healthy fats. I would say whole grains, but you guys know how I feel about whole grains. Okay. It also limits the intake of processed meats, simple carbs, sweets, saturated and trans fats, and alcohol. All right. So, nutrients that are essential for serotonin synthesis. The body requires adequate amounts of nutritional cofactors to support hormone and neurotransmitter production. So, serotonin production relies on nutrients such as tryptophan, vitamin D, omega 3 fatty acids, magnesium, zinc, iron, and vitamins B6, B9, which is folate, and vitamin C. So, including foods rich in these nutrients can help maintain optimal serotonin levels. So, let me give some examples of the different food sources so that you guys are aware. So folate, our B9. Folate can come from our spinach, our liver, asparagus, Brussels sprouts, right? I love them. Iron, of course, beef, your oysters, liver, chicken, dark green leafy vegetables for my vegetarians, beans, molasses, tofu. Magnesium, where can we get that from? Pumpkin seeds, chia seeds, almonds, spinach, black beans, edamame, brown rice. And then our omega 3s, which is super essential, period, to our diets. Our salmon, mackerel, sardines, anchovies, flax seeds, chia seeds, hemp seeds, walnuts, and the list continues. And then our tryptophan. When we hear tryptophan, we always think about turkey, right? Falling asleep. But we have it also in tuna, lobster, beef, poultry, soybeans, pumpkin seeds, quinoa, salmon, right? And then our vitamin B6s, we have our chickpeas, our beef liver, fish, potatoes, our non-citrus fruits. So when people ask, do I have to eat all this? Do I have to take supplements? You choose whatever path you want to go down. Vitamin C, where can we get that from? Your strawberries, kiwis, red bell peppers, your tomatoes, your citrus fruits, potatoes. And then your vitamin D, cod liver oil. It doesn't taste the best, but that is a good source of vitamin D. Rainbow trout, beef liver, fortified milk, salmon. And then we have zinc. Where does this come from? Oysters, beef, pumpkin seeds, eggs, milk, fortified breakfast cereals. Okay? So, this is how your diet could be improved. Because remember, we need these nutrients for serotonin, the feel good drug. We need to have great serotonin synthesis. We need to have great hormone production. So, now we'll explore lifestyle modifications and natural therapies of seasonal affective disorder. So, I mentioned earlier about light therapy, right? So, light therapy shows significant promise in treating this because light boxes mimic sunlight, which is what we need, aiding in vitamin D production, serotonin levels, and circadian rhythms. So, the clinical effects include reducing daytime sleepiness and excessive hunger. Look at that. So, you mean to tell me if you put me in this light box, my hunger actually may decrease? Sign me up. right? Sign me up, because remember, one of the symptoms of SAD was overeating. I was literally just talking to someone today and I said, "Man, I just can't stop eating. Like my appetite is just there." So you mean to tell me all I have to do is go in this light box and that may reduce my hunger, along of course with helping to reduce my insulin resistance and all that good stuff. But this is another resource, right? So standard light therapy involves 30 to 60 minutes of daily light exposure, okay, with 10,000 lux intensity. And it's actually often combined with antidepressants for enhanced effectiveness. Okay? So light therapy sounds like it's where it's at, right? And now, importance of sleep hygiene. So it is critical for patients undergoing light therapy. SAD can cause phase delayed circadian rhythms leading to insomnia. So, recommendations include avoiding bright lights, especially blue lights, before bedtime. So, that means put the phones down. I know most of us like to sleep with our phones in our hands or right next to us, or we try to go to sleep right after getting off the phone or watching TV. It may take us a little longer to get to bed. Maintaining a consistent sleep schedule and create a calming sleep environment. So if you have to light that candle, do it. If you need to shower with aromatherapy, do it, right? Avoid caffeine and alcohol in the afternoons and the evenings. It doesn't mean stop it completely if that's what you like, but for most of those weekdays that you are busy, avoid caffeine and alcohol, okay? Exercise is another treatment strategy. So, aerobic and resistant exercises are beneficial for mild to moderate depression. So, there was an 8-week trial that showed that aerobic exercise, about an hour, about 2 to 3 times per week, was actually more effective than relaxation training in improving SAD symptoms. So, isn't that funny? To me, that was funny. So, exercising is actually sometimes better than relaxing. Okay. Now, let's dive into the role of supplements in treating seasonal affective disorder. So, supplements. Let's talk about this. This is my soapbox. I know my patients get tired of me talking about supplements because I supplement them to death. I will say, yeah, you need to take this supplement or you need to take this supplement. I really mean that. And what I like to stress is that most supplements are not lifelong, they're just a supplement. If our diets were up to par and we were getting the nutrients that we were supposed to be getting, then you probably wouldn't even need as many supplements. Okay. So I always try to frame it and say, listen, it is better than definitely being prescribed something if you don't have to. Okay. So supplements. So the effectiveness of herbal remedies. Let's get into that. Let's get into this team. So there was a 2018 review that suggests that herbal medicines can alleviate mild to moderate depression symptoms. And some herbal remedies are as effective as standard pharmaceuticals. Supplements and herbal remedies can reduce the need for medication and associated side effects. That is the line right there. Reduces the need for medication and associated side effects. So when we're on those antidepressants and you notice that you're gaining weight, your mood is a bit weird, and your libido is low, or you have erectile dysfunction, hmm, looks like you guys need to sign me up for supplements for 1,000 Alex, okay? Because that's where those medications can hit the road. We do not prescribe medications until absolutely necessary. So let's talk about vitamin D and SAD. Vitamin D has been strongly researched in relation to SAD. There is an inverse relationship between vitamin D levels and clinical depression, and the deficiency was often due to a lack of sunlight exposure or dietary intake. So, supplementation showed significant improvements in depressive symptoms, right? And dosage varies. I know my patients usually take 5 to 10,000 international units daily, which is usually one capsule, and they take it with the cofactors vitamin D3 with K2, magnesium, and fat, and making sure that there is iodine on your meal, which is salt. Iodine, true iodine, not pink Himalayan, true iodine. And only a sprinkle because that is great for thyroid health and is great for vitamin D absorption. However, always consult a healthcare provider for safe and effective dosing because that is crucial. I know a lot of our people listen to a lot of herbalists online, and that is fine because you want to be, educated. But sometimes there are certain dosages that are just not safe for us. I had one person taking 100 times the amount and it made them really sick. You know, now sometimes I'm all for researching, but sometimes just ask. But you want to ask the right people again. So make sure that you are consulting a healthcare provider. If you have any questions about that, send me a message. I'll answer it for you. Okay. And so, lavender, another supplement. So, here's lavender's role. And hint, today's tea, lavender tea, also aromatherapy. It calms the nervous system by balancing out the neurotransmitters. So both by aromatherapy and oral forms have shown significant antidepressant effects. And it is comparable or even superior to SSRIs in efficacy. To me, that is the key line right there. And these are from studies because it is safe for use alone, or you could use it in conjunction with pharmaceutical antidepressants for mild to moderate depression. So, for these winter months, I'm going to ensure that I am drinking lavender tea at least a couple times per week. Depression isn't fun in any form, it's not fun. Who wants to be sad all the time? And then saffron, another supplement. Here are saffron's benefits. It is clinically effective for mild to moderate depression, right? The dosage recommendation is usually 30 milligrams 1 to 3 times a week, or excuse me, 1 to 3 times daily. So you may get supplement fatigue. I'm really big on that. Sometimes you have to ease your way in here, right? So if you are one of those people who you just don't like to take any kind of medication supplement, it doesn't matter because you may forget, do the lavender tea first. Okay. Now move towards that vitamin D, right? And then you can work towards saffron. Okay. No biggie. You just want to make sure that you do something. All right. Now let's discuss the integration of conventional and functional medicine approaches for treating SAD. So remember, I am not, punching mainstream in the face. I never want to ruffle feathers. My goal is to tell you the differences, what's going on, and how things can be changed, right? So here are some holistic integration of approaches. Functional medicine complements conventional treatments for a holistic approach because we aim to identify and address underlying factors that are contributing to SAD in the first place. So, personalized care is huge in functional medicine, okay? Because the personalized approach is central to functional medicine. That's why functional medicine has the name. Treatments are tailored to the individual's unique health profile and needs. So, while you may need Lexapro or Wellbutrin, this person may need lavender. This person may need vitamin D. This person may need to have their neurotransmitters checked. They may need a Dutch test to figure out their melatonin and their cortisol levels. They may need to get their cortisol levels fixed because their sleep wake cycle is flip flopped. Okay? That is where functional medicine comes in. So, combining complementary and conventional modalities like psychotherapy or bright light therapy with pharmacotherapy, that actually may work because now you're working in conjunction. So such synergy leads to improved health outcomes. So one isn't bashing the other. It's just that we have so many different people with so many different walks of life. We cannot just give one thing, one option to just anybody, right? We can't just do that. We have to make sure that there are other options and that these options have been exhausted. Remember, we are in 2023. People are reacting to medications very differently, right? People are much more sensitive. The diet is terrible, poor, so they have poor gut health. Their absorption is terrible. Nothing is working. And remember, we just got over COVID, and not necessarily got over COVID. We got over the rough part of COVID. We're still in COVID times. But think about how that has created such issues with seasonal affective disorder, right? It's so much. So here is my functional medicine strategy for SAD. I am going to focus on the comprehensive management of your depression. Because, yes, this may happen during seasons, but it's time to figure out what's causing it. So, I'm going to help to possibly integrate conventional treatments with tactics of targeting root causes of mood imbalances. I may help that. Or we may just focus on the root causes of the imbalances, which could also be hormonal. How is your testosterone levels? How's your progesterone? How is your estradiol? How is your DHEA? How's your thyroid? So you see how all that plays a role. How's your iron? How's your vitamin D? How's your vitamin B? How is your liver? Are things being metabolized appropriately? How are your kidneys? Are you excreting the way you should? So you see how everything is one big circle, right? So guess what? I aim for a well-rounded strategy to combat winter blues. Because if we can combat winter blues, then I may be able to help promote year-round happiness. And now, how does that sound? Year-round happiness. That means that we no longer need medications. We just need supplements that's going to keep us in tip-top shape. But how can you get there? You can get there by actually having a provider who is willing to dig deep. That is the most important thing here. Having a provider to dig deep. Okay? Because seasonal affective disorder is not surface level. It is deep down. How are your serotonin levels, right? You need to make sure that you get a provider who is one to one with you, who can provide resources for you, who's going to be available for the things that you need, right? Okay. And so here's another thing I actually forgot to mention. Who has heard of the NAC shot? N-acetylcysteine. Who has heard of the NAC shot? So, NAC. NAC is a holistic boost for body, mind, and breath. It is for relaxation, depression, anxiety. It enhances the immune function, supports liver detoxification, it improves respiratory health, and it acts as a powerful antioxidant, reducing inflammation and promoting overall well-being. So, N-acetylcysteine. Usually, that is one shot or two shots per week because that helps with depression. Okay. And our relax blend shot. So you need to relax, recharge, renew, right? So what is in it? We have GABA, magnesium, taurine, theanine. It helps again promote overall well-being. Okay. All right. So thank you all for joining me tonight on this stream. Hopefully this has gone over well on Instagram. So this is our first time that we're going live. Super excited about that. Absolutely. But thank you all for attending and supporting Health Tea with Dr. B, the NP. I super appreciate all of you. So we had 2 episodes until the end of the year. We have next one coming up on December 27th, which is next Wednesday. I cannot wait for that one as well. So before you leave here, please remember to follow Health Tea with Dr. B on Facebook, Instagram, and YouTube. Just follow us. I appreciate all of you and all of what you guys have done to have landed me here. So again, you can also visit us on bit.ly/health tea with Dr. B. There you can actually buy the lavender tea. If you're trying to decrease your depression levels, um, hey, and purchase a nice cup because I get all my cups from Amazon. I am a cup queen. So if you guys want me to promote your cup or drink your tea, I absolutely would because I am a tea drinker. Okay. So again, that is bit.ly/health tea with Dr. B. Okay. And don't forget to visit the shot bar. All right. You can visit our shot bar because our shot bar has all the shots that you would need. And it is bit.ly/true shot bar. All right. You can use health tea for 10% off. I'm still in the mood of giving, especially because you guys have given a lot to us to make all of this possible. We are truly grateful for all of you. Okay. So, once again, thank you for joining tonight. Tonight's episode was about holiday blues unwrapped. I hope you all are going to be doing well. I'm sure that you will do well. Please implement the strategies and the holistic remedies that you heard of tonight. If you have any questions, please do not fear messaging me on Facebook or Instagram or visiting me at bit.ly/ health tea with Dr. B. Look, I forgot my own self, right? All right. So you guys take care. Merry Christmas because I won't see you until after Christmas. So Merry Christmas, guys. All right. Bye.